Today we have with us Dr. Mary Neal, and the impact she has made in this community through gifts into cancer research, through serving at San Jose Clinic as one of the physicians, and so many other ways that she's helped the community are really remarkable. But the best part of this episode is hearing the love story between her and her husband. It's one you won't want to miss. When you subscribe to our show, you help us grow. Someone you know may need to hear this story, so please share with your family and friends and consider supporting our mission at therose.org. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Dr. Neal, it is so nice to have you here at The Rose and to be part of our podcast. And I have so many questions for you. And the first one is, you were in medical school pretty young.
Yes.
Tell us about this journey of becoming a physician.
Well, I decided I wanted to be a doctor when I was 12. I was a freshman in high school. I had the most amazing biology teacher, and the lab just ignited my interest in pursuing that. And so from that moment on, there was nothing deterring me from that pathway. I was the first member of my family to graduate college. I had two older sisters. They got married at 19, had babies, and just dropped out of school. And so my father, it was a dream of his as well that I accomplished that. So I actually finished college in 3 years because I was anxious. I got some advanced credits and got through it. And
I don't, but this is a very, that just didn't happen back then unless you were really smart.
Well, you could.
Okay.
You could. And so then I got into medical school. I guess I was 21. And it met all my expectations. My father said that the reason I went into medicine was that I never wanted to quit school. He realized that, how many years it was going to require for me to accomplish, and get to the point where you actually get out and have a job. But he was really right, because it's a lifelong learning experience. You never stop learning. I mean, I'm reading journals, every day just to keep up with what's happening in other facets of medicine besides the area that I specialized in.
When did you know you wanted to be an OB/GYN? When did you know that?
I went to medical school thinking I wanted to be a pediatrician. Oh. And the best thing that my medical school did for me was during our pediatrics rotation, we actually went one afternoon a week and shadowed a pediatrician in their office. And that's when I discovered that I love children, not so much sick, crying children. And, it's okay when they're your own. But anyway, I loved dealing with the moms, and I loved delivering babies. I was hooked at the first one that I got to deliver. And I loved having that really very special rapport you have with a patient, because, you've seen them for multiple visits during their pregnancy. Their husband, there's other support system, their parents, their other children. It's just it's so wonderful to be invited into that.
Into that fabric of life.
That
into
miracle,
that, yes.
And it is every single time. I never bored of it. It was just wonderful.
Now, are you doing the same thing in your volunteer work at San Joe?
No, we don't.
San Jose? Yeah.
No, we don't do OB.
Okay.
We're just essentially office gynecology. We will diagnose a pregnancy, and then we help navigate them into OB care. Because the state of Texas does provide any pregnant woman qualifies for Medicaid.
Right.
And so they can get care with any physician who will accept Medicaid patients.
And my goodness, this is a critical time for them to do that. So that is a really good point. That has been San Jose has been one of our partners for I don't know how many.
We're so grateful for that.
Well,
Yes.
we were for you too, because we had someone would call us, and you always have to have that physician or that clinic or, involved in all this, and it was a place we could actually send people. So,
That's good to
and
hear.
of course, I think, and I'm not sure about this, but I'm sure you've heard of Dr. Pope.
Oh, yeah.
Yeah. She was there at one point,
Yes.
and now she's at St. Mary's, I think,
Yes.
clinic.
Yeah,
Yes.
a different clinic. Yeah.
Let me tell you, that woman.
She's a fireball.
She
She's amazing.
She is.
Yes.
She has such a way of getting those patients on that mobile van. It's amazing. Yeah. But I think that community service, especially doctors like you and her, it just gives you a different aspect
Oh, for sure.
about what's going on in our world.
And it's a shame that basic health care isn't in the United States considered just an inalienable right, and it's not. And so often you see patients further down the road of medical dilemmas because they didn't know where to go, or they didn't have a regular primary care doctor following their course. So yeah, it's clinics like St. Mary's, San Jose, and others. They provide a very important service to all of our wonderful citizens who may have not had an opportunity for insurance.
And we see that so often. When we screen women on the mobile, and we serve insured women too, their staging is exactly the same, because it's screening.
Right.
But the majority of our uninsured women are coming with a problem when they're coming to the centers. And it's just insane that we don't have more emphasis on the different screeners and availability and accessibility. Because it can make such a difference for sure.
We appreciate what a wonderful service that y'all provide. By one, providing the mammogram, but it's not just there. I mean, you go on to, if there's a problem, you do the diagnostic testing, you do the biopsies. Then you have navigators that, it doesn't come back to us of, oh my gosh, where do we go now?
Right.
Y'all, you do a wonderful job.
Before we continue this episode, I have to let you know about something that is happening throughout this month of July. Our anonymous donor is at it again, and she wants to match your donation up to $100,000. So think about it. $20 is now $40, $100 is now $200, and if you're feeling really generous, $1,000 is now $2,000. Just think about all the women that we could help with your donation and our anonymous donors match. Please go to therose.org. It's easy to make your donation there. And as our donor said, every dollar counts. Now back to the podcast. You might not know this, but we had a physician network for the longest. I just have it in my head that you may have been a part of that, because it was community doctors who said, we'll help you. This was before you had any programs in Texas. And I think that was when, or just because we had that, the doctors became aware of us. They started to know us, and that helped us grow. I mean, there is a real compassion that goes on in this city that is just unbeatable. And when it comes to those that are not quite able to do what they'd like to do, it really makes a difference. So, yeah, thank you. Thank you for being part of that.
One of the other missions that San Jose has taken on is that we're seeing some of and as the gynecologist, I'm sort of the front line, but we're seeing some human trafficking victims in the city. And, in private practice, that was just something, you did a little, CME learning on, and you didn't ever think it was going to touch your life. And I've taken it on, in my case, as being kind of, it's a mission for me to, just to have respect and give everybody dignity, and just to hear some of their stories. You just wonder how they're such survivors, and it's it's a special time, that I didn't have that opportunity in private practice. So I feel like, maybe God put me in this place to have that impact,
so interesting.
Yeah.
Yeah, and to have that person you can tell your story to without shame or without judgment.
Exactly.
What we've learned in this podcast is sometimes just being able to talk makes all the difference. And you discover things you didn't know you had, or, you find other resources. So, my goodness, I would never have thought about
I know
that.
most people don't, and it's a challenge and an opportunity.
That's a good way of putting it. Yeah.
Yeah.
So, I want to know how you describe. I know you've been very involved in Methodist, very involved in creating some of their new work in the cancer field. But I want to hear you describe Jenny Chang, Dr. Chang.
She's an amazing. She's brilliant.
Mm-hmm.
She comes off as being very kind of stoic, but she is got the kindest heart, and she just wants the best for every patient out there with that diagnosis attached. And there was a story a while back that Methodist acquired a hospital in Baytown, and with it came this one of the doctors had an amazing frozen specimen collection, all kinds of cancers, but a lot of breast, tissue that was saved, and so it kind of like when Methodist bought the hospital, it was like everything was included, and so this was kind of dumped on Jenny, and she said, this was like a landmine of things to be able to study. These specimens from 40 years ago.
Oh my gosh.
So you could look at the evolution of what's happened, And she said, this is not just for us. This is too important. So she kind of like sent out a blast to everybody all in the cancer world and said, anyone who needs, wants, desires any of this, we're happy to share it. And so that's the kind of collaborative effort you need in cancer. You want to have your name published on a paper, but you also are there for a reason, and that's to stamp out this disease,
She always reminded me of like this quiet whirlwind. There was all this stuff going on around her, but she's so calm. And some things she doesn't, jump out there and announce. But when she was during her journey, she graduated, I think, from Oxford, getting her first degree, her undergraduate degree, and she was waiting to go to medical school. And she had she finished in so fast, like brilliant. So she had this little bit of extra time, like a year before she was going to start medical school. She went and got a divinity degree. So, there's a spirituality about her, too, that she doesn't always share that with everybody, but I think that makes her a really caring physician. And my friends who've had cancer and have seen her see that side of her. Yeah, we've had several who have gone to her. And she used to be our primary person to send folks to. But, yeah, she's just I didn't know all that. I've been trying to get her on this show. Now I have some extra. She promised me she would come, but just getting her here is
she has a busy life. Yeah.
Now, Dr. Neal, did you know about the Rose before San Jose?
I did. When I was in private practice, I knew that y'all were here. We, in my office building, we had our own breast and imaging center, and we kind of had our surgeons we used over there. So we I tended not to, I didn't necessarily refer to y'all, but I knew of your wonderful work here. And then, of course, became intimately involved when I started volunteering at San Jose.
When I think about some of the years that we've been out there, it is amazing how many physicians were back there when we were beginning that we didn't even know we had that support. We were always kind of small. So it was just, it's so...
Well, I remember I don't know her, but Dixie Malello was one of the first physicians with y'all.
Yeah, she's a co-founder. I mean,
Right.
and she's still here.
That's
you know,
wonderful.
that is, it really is. Her patients just love her, and she brings a very different sense of compassion to everything that we do. She's very, very clear on what women need and how we need to change things to make it better.
Yeah.
So what would you say is, and since you're working in this population of the under-resourced,
Right.
uninsured, what is the number one problem that we could solve? Now, that last part could mess it up, but
Well,
in your mind, what's the number one issue?
I try to educate all my patients as to why they should get a mammogram. There's so much misinformation out there about, oh, it hurts, or, and my answer to them is, a mastectomy hurts. Don't you want to do something and find something earlier so you don't, that you don't need to have the major surgery down the line or chemo and all that. So I always tell them, you need to be doing your own breast exams, but that's not enough, because we can find breast cancer before you can feel it if you do your mammogram. And so, that helps. I guess our patient population, we have a fair number of no-shows just because of all, life gets in the way. These people, they have one car in the family and the husband works 7 days a week.
And you thought you could make this appointment, but then your boss calls you in to work that day. Oh, yes. Yeah.
So I think those are the logistic problems that probably handicap some of our patients from doing it.
Especially in this city. I know we have public transportation inside the loop, but people getting to this location, very hard if you don't have a vehicle. It's just
for a short while, we had some grant that was paying for Uber to get some of our patients in. Oh. So they could, if it was really important for them to make a follow-up visit.
See, those are the kind of community resources we need. And it doesn't have to be overwhelming. It could just be for those that actually need to get in.
Right.
We do gas cards for our ladies that need the diagnostic workup. But you got to remember, we're serving that rural area.
Right.
And if one of those ladies needs to come back for a follow-up, it's a 2.5, 3 hour drive. I mean,
wow.
This is not an easy thing. And the counties that we serve, half of them do not have a mammogram center, a breast center. They do well to have any kind of physician presence in their communities. So it's a drive for them anywhere they go. So do
you send your mobiles out there, but then when they have to have the diagnostic stuff, they come back here? Gotcha.
One of our goals is to turn a couple of those units into a diagnostic.
Wow.
But that's a few steps away. I
know.
It just takes so much. All right, so I have this one question that has just really bothered me. And I want to hear the story about how you met your husband. I know there's a love story in there, and I think everyone realizes that you're a huge community support volunteer. The gifts you've given to make our medical centers, especially Methodist, are just phenomenal.
Well, thank you.
But it's always kind of like the two of y'all doing it together.
It is because we're very aligned as a couple. So back when I was in college, went to LSU in Baton Rouge, and it was a summer. I had just broken up with the guy I had been dating for a while, and one of my pre-med friends, because you have a network of all the people that are in pre-med, and he dropped by. He lived in an apartment in our building, and he had this friend with him. And so I met Ron through Jose, and at the time I was with my roommate. We looked similar. I mean, we're the same height, brown hair, Anyway, after the meeting, Jose mentioned to Ron that I wasn't dating anyone, he should call and ask me out. So he did, and it's back to the old regular, no cell phones, right? And so he called, and that Saturday, we had arranged to have a date, and that Saturday, I answered the door. Miraculously, I was actually ready on time, and and he saw me, and it was like there was this little startle, and he said, "Oh, you'll do." And I didn't know at the time, he really thought he had a date with my roommate, which they would never have kicked it off. But, they're dear friends, but it was just kind of humorous. I didn't know what "you'll do" meant. I thought, I was dressed appropriately or whatever. But it was this very strange night when I got home. That was the other thing. He took, on our first date, he had a key to the life science building because he was doing some physiology research. He didn't go into medicine, but anyway, he was in this graduate research class. And I just thought it was incredible that you could get into the life science building after dark on a Saturday.
He impressed you.
Yeah. So he took me there and then explained to me that the tarantula had gotten loose that week. So that sort of ended that little opportunity to visit longer. And so I told my roommate when I got home, I said, that was the strangest date I've ever been on in my life. And she said, well, are you going to go out again? And I said, well, yeah. I want to see what the next one's going to be like. And I told my dad that I was going to laugh every day for the rest of my life, and I have. And we're very aligned in our in our values. We don't always agree politically or about everything about child rearing. There were some times in there where I was good cop, he was bad cop. But, in the long run, we have such respect for each other, and we both feel that, you need to leave this world better than it was when you got here. And whatever it is, if it's little things, little acts of kindness, little whatever, that's what's important. We always told our children, marry someone who's kind, and marry someone that you want to be better for every day. That you want to be a better person just because you're with that person.
Oh, that gives me chills.
And so we're we do things together. We sat down when we made decisions about where we want to help. Mm-hmm. We do it together, making that decision. And he's a special guy.
Well, it sounds like it. And you're about to celebrate.
We will, this year's 49 years. Next year will be 50. I hope we'll do something kind of special for that.
We have to.
Yeah.
Congratulations.
Thank you.
My goodness. See, it's those stories that keep us going.
Yeah.
You're both professionals. You both had a lot of responsibilities and stress, I'm sure, through these years. But, boy, when you have that person that's...
You have that partner who's got your back. Mm-hmm. Oh, my gosh, was he a Mr. Mom? I mean, he really carried a lot of weight when I had 3 kids and was delivering all those babies and doing that. Yeah. So
your time was
But you know what he said? He said, I would always apologize when I'd come off a weekend call and I was just wasted because I was on call for so many doctors and stuff. And he would say, I'd say, I'm so sorry you had to do this. And he goes, it is not a burden. It's a pleasure. You're giving me an opportunity to spend one-on-one time with my children. And let's face it, if you were here, they're about mommy. So, he's very close to our grown children now. So.
That is a good story. Mm-hmm. Whole different way of looking at it.
Yeah. Again, challenge, opportunity,
I don't think we've heard that expression on this show very often, but that is a great one. Great.
Thank you.
Great model. Why do you believe the new therapies that are coming out for cancer are so important?
I do. When I was an intern in the medical ICU at Methodist here in Houston, we had a lady who had terrible breast cancer that had literally invaded her skin. You saw the tumor. And she had already gone through all the chemo and everything. And she was staying alive long enough to try an immunotherapy technique that was really just starting back then. It was, we're talking 40 years ago. And, she was very brave. I look at her as like, just one of those amazing people. But that stirred in my mind that, all before that it's radiation and chemo, which is essentially poisoning a lot of your own cells, your good cells, just to get rid of those bad cells. Wouldn't it be great if you could target it, And so then that all started happening in the course of my career of, all this, it took a lot of steps along the way to figure out all that immunology and all that, how the process could happen. And I don't begin to understand, a minuscule amount of it, but it just made sense if we can do that. Melanoma is one of those cancers that seems to have responded. There's a lot of drugs they're using for melanoma. There's a lot of things we have yet to learn, though, because there's so many cancers that there's, it is still a death sentence, pancreatic and some of those things. But we just, Ron and I were trying to figure out where can an impact be made and where does it need to go? And it's not like I don't believe in chemo or radiation. Right. I think those are sometimes those are the most direct and better ways to treat some of these things. But it's a field that's just going crazy with the amount of discoveries that they're making. And personally, my daughter-in-law's mom was diagnosed 5 years ago with lung cancer. She's never a smoker, wasn't that kind, and she had chemo, and her cancer just laughed at it. I mean, just and she got on an immunotherapy regimen, and here she is 5 years later. That lady is blowing and going, and she still has cancer, but it's like under control. She has, there's side effects she has to deal with the treatment, but she looks at it as every day she has with her grandchildren is a blessing, so. We never thought that she would have 5 years, but it's so these this is a whole new frontier.
It
really
is, and it's so promising. Oh my gosh,
yeah.
But what a story! 40 years ago, you were being told there's
it was
a
like
way.
You planted a seed there, and it probably she may have been the one and only patient that they did that with, but because but still.
It's an exciting time to live, especially in medicine, and so much. You look back at what we did 40 years ago, and it's so different now. So we should be what's the word? Positive. We should be anticipating so much more that could be out there.
It would be, it'd be great, if we could just, X out cancer as you treated it like everything else. Like, think about it. 20 years ago, HIV was a death sentence.
Oh, yes.
Now it's a chronic illness that you take care of, like hypertension, diabetes,
Tuberculosis.
There you go.
Go back to, we just forget. I mean, I lived in the time of the polio and had cousins that were in iron lungs, and you were terrified of that time. But look at us now. It is exciting. It's a great time to be in it.
It is. It's very exciting.
Well, I want to thank you personally for all the ways you've helped the Rose. And there's so much more that we can do in the communities that we serve. And I really, really appreciate that you've taken that on. That's a different world.
Yeah.
Yeah, but it is great. It's been great to have you here.
Thank you.
And I love the love story.
It's a little quirky, but
no, it's great. Sometimes I think we forget we're women first, and we always, when we're fortunate enough to find that person, then it's not just for us; it's also for them. We don't talk enough about love in this world.
Oh, that's very true. That's very true.
And that's really all we have at the end of the day.
Right. Yeah. And that's why we're serving people too. I mean, that's the way you give.
Oh, it is.
It's not giving to the whole. You're actually often giving to the one-on-one, and that's where it's really important.
That is. That's so true.
Well, thank
Any
you.
last words? Any advice you want to give anyone who's thinking about community service or
Oh, wow.
being a doctor or?
So I tell all of the pre-med students that will, we have a few that rotate through San Jose. They come as translators because my Spanish is very rusty. And I'll sit them down and say, well, what got you here? Why do you think you want to do this? And I say, I want to impart a little bit of my advice, and that is that medicine is a life of service. That if that is not a primary motivator for you, you will be a frustrated physician. You won't, if you're always looking at, your bottom line on the money or whatever, that we're really here to help people. It's a very rewarding job. It's intellectually stimulating. You're never going to be bored. No two patients are the same. Those are all good things, but you have to give of yourself. That's why I've loved what I do, because it allows me to do that.
To give.
Mm-hmm.
Yep.
Yep.
Great advice.
Yep. Yep.
Thanks again for making this journey and for being with us
Dorothy.
today.
Thank you. Appreciate it.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.